Today we are discussing a very interesting question in regional anesthesia. For many years, peripheral nerve stimulation was considered the gold standard for nerve localization. Then ultrasound arrived and completely changed our practice. Today, most regional anesthesiologists rely primarily on ultrasound guidance. We can see the nerve, the needle, and the spirit of local anesthetic in real time. But does that mean nerve stimulation is absolute? Should we completely abandon nerve stimulator? Or do they still have a role in modern regional anesthesia? In this article, Jeff Gadsden explored the evolving role of peripheral nerve stimulation in the ultrasound era and discussed whether nerve stimulation still contributes to blood success, safety, and education. Let's take a closer look. Several studies have shown that ultrasound provide higher blood success rate, fewer vascular puncture, less procedural pain, and less need for rescue analgesia. Unlike nerve stimulation, ultrasound allows us to visualize the nerve, the needle, and the spirit of local anesthetic in real time. So, for nerve localization, ultrasound is clearly superior. But if that is true, why are many experienced anesthesiologists still using nerve stimulation? Let's look at the answer. Interestingly, adding nerve stimulation to ultrasound doesn't improve success rate for most common blocks. Studies on femoral, interscalene, infraclavicular, and popliteal blocks showed little or no additional benefit. However, the story changes when nerves are difficult to visualize. For blocks such as the obturator nerve block, nerve stimulation can still improve accuracy and success. So the message is simple. Doesn't use nerve stimulation for every block, but don't throw it away either. The most important message of this review is that nerve stimulation has a role. It is no longer primarily used to find nerve. Instead, it acts as a safety monitor. When a motor response is obtained at very low current, especially below 0.2 milliampere, needle nerve contact becomes much more likely. In other words, nerve stimulation may help us avoid nerve injury rather than simply locate the nerve. So, what is the take-home message from the review? Ultrasound remains the gold standard for nerve localization. However, nerve stimulation still has value as a safety tool and as an educational aid. The authors conclude that these technologies should not be viewed as competitors but as complementary tools. Ultrasound help us find nerves. Nerve stimulation help us safety away from them.